Hi, welcome everyone. We're just going to wait for some more participants to roll in and then we'll get started soon. But thank you all for being here today. I'm not too sure how many we're expecting, but I think it's okay to start soon. So hi everyone, and thank you all so much for joining us today, and welcome to Cultura y Corazon, a decolonial methodology for community engaged research presented by the Department of Chicano Latino Studies and the Social Sciences Academic Resources Center, also known as SARC. So my name is Alina, and I'm one of SARC's peer consultants, and I'll be moderating today's session. So if you have any questions during our time together, please submit them through the Zoom Q&A feature, which is on the bottom of your screen, and we'll be addressing these questions towards the end. And I would like to now welcome Associate Professor and Director of Undergraduate Studies, Dr. Glenda Flores, to share a few words about the purpose and goals of our session.
Thank you so much, Alina. So welcome everybody to this in-community event with Dr. Rosa Manso. Like Alina mentioned, I'm the Director of Undergraduate Studies for the Department of Chicano Latino Studies. And this counts as one of our Chicano Latino Studies certificate events. It definitely fulfills the requirement for the social determinants of health certificate, as well as others in the department. I would definitely encourage you to look at the website and see if you're interested in pursuing one of our 4 certificates that we currently offer. I'm excited to have Dr. Rosa Manso here to talk about her amazing work. I've actually known Professor Manso for a couple of years, so I'm excited to see her, the work that she's doing now at UC Merced. And for any of you that are here, if you are interested in picking up the Chicano Latino Studies major or minor, or learning more of about the certificate, feel free to reach out to me. And I want to extend my deepest thank yous to SARC, Carissa and Patrick, for helping us co-host this event and reach a broader audience. So with that, I want to turn it over to Carissa and Patrick so they can introduce our speaker. Thank you so much.
Yeah, we'll actually have Alina introduce Dr. Manso.
All right, thank you, Dr. Flores. And it is my great pleasure to introduce Dr. Rosa D. Manso. And Dr. Rosa D. Manso is an interdisciplinary community-engaged researcher. She has extensive experience with community-based participatory action, research for program development and implementation in the health and education fields. She has developed partnerships with promotora groups across the San Joaquin Valley region and has successfully trained them as data collectors. She has been critical in the development of medical school curricula that incorporates a community-engaged approach to addressing health disparities in the San Joaquin Valley. She draws from evidence-based practices and her lived experience as a first-generation student from the San Joaquin Valley to engage educational leaders, community stakeholders, professionals, and policymakers in the development of effective programs that address the health and education needs of underserved communities.
Thank you so much, Alina, for that introduction. And it is a great pleasure to be here with everybody. And thank you, Dr. Flores, for inviting me to speak with the group today. I'm very excited to share a little bit about my work. So let me do screen share. Okay. So today I'm going to be talking about my book, Cultura y Corazon, but I wanted to start off with a little bit of background about myself. As Alina mentioned in the introduction, I grew up in the San Joaquin Valley, and this picture I wanted to share with you for those of you who may not be familiar with the San Joaquin Valley. We're located right in the middle of LA and the Bay Area. My hometown is actually about 20 minutes out of the I-5 as you're driving up north on the I-5. You probably have seen just vast fields all around and think that there may be no communities around there, but actually there is. Once you get off the freeway, these are the roads that you encounter. And so for many years, as during my graduate school training, this is the road that I would take down to go back to my hometown, where I was actually conducting research in 2 communities in the San Joaquin Valley. So I wanted to share this with you to give you a little bit of background as well. And many of you may be familiar with the falling through the cracks pipeline, the work that Perez and et al. Have developed. And so I wanted to start off with this because when I was an undergraduate student at UCLA, this really resonated with me when I started to look at the numbers specifically for Latinos, and Chicana students in terms of how we are progressing through the educational pipeline. For me, this was a very eye-opening experience when I learned about these statistics and these numbers, not only because of the numbers nationwide that were represented, but also because at that time I was the only student from my high school at UCLA. So I knew something was wrong and I wanted to address that. And I told myself, we got to do something to change these numbers. At the time, as an undergraduate student, I was not sure what that meant or what I needed to do to change these numbers. But I started to explore activities and initiatives on campus that would lead me to where I am today, to try to advocate for students for educational opportunities, so that little by little we start to change these numbers. And so, as I mentioned, as an undergraduate student, I was interested to know my own pipeline from my high school. I went to a very small high school, Tranquility High School, about total 400 students. So there's about 100 students per grade level. And when we look at the work that has been coming out of UCLA and now other institutions, some of the things that we notice is how students are falling through the cracks. So I started, as an undergraduate student, I started to play around with the databases to discover what was happening at my high school. And what I discovered for my graduating class was that out of 100 ninth graders that started, only 64 of us graduated high school. From the 64 graduates, only 12 of us completed the requirements to a CSU and a UC for admissions to a CSU or UC campus. From the 64 that graduated, 21 went to community college, 3 to a CSU, and 4 to a UC. And I could tell you who those 4 students who went to a UC system were, because there was only a handful of us. And so we knew where we were, we kept in touch with each other. And so knowing these statistics was very frustrating and upsetting, and I knew something needed to happen, right? And so here I am as an undergraduate student at UCLA, trying to think, what are the next steps? And so while I was at UCLA, I started doing research at the Brain Mapping Center. I was a psychology major, and that research was very, very fascinating. Nonetheless, one of the questions that I always asked myself was, how is this changing my community? How is this important for my community? The work that I'm doing here at the Brain Mapping Center. And not to say that the work was not important, but I wanted to see more how that impacted my community. And so I picked up an education minor while I was at UCLA, and I started to do research. And I conducted a study at my high school that explored the experiences of Latina students in STEM classes and how that impacted their own educational aspirations and their perspectives of themselves going through higher education. So I conducted that research study as a McNair research scholar. And so then that led me to explore graduate programs. And at the time, UC Merced was just starting up. So the only other institution close to the San Joaquin Valley was UC Davis. And there's a few scholars at UC Davis who were actually conducting research within the San Joaquin Valley. And so when I started to explore graduate programs, I found the work of Dr. Adela de la Torre, who is now the president of San Diego State University, and she was doing a lot of research around the area of education and health in the San Joaquin Valley. So I went to UC Davis for my PhD and stayed there for a postdoc, and then that led me to UC Merced and UCSF. I am now the Associate Director of Medical Education at UC Merced and work very closely with UCSF for the development of the San Joaquin Valley program in medical education. And so my work is really centered around community engagement, but how do we use our scholarship to change our communities and enact the community capacity that exists in our communities to make sure that those disparities, the challenges that they're facing in their community are addressed, and that we use our research to change the world. So the book, Cultura y Corazon, a Decolonial methodology for community engaged research, is a collaboration with some of my colleagues from UC Davis, who over the last decade, we've collaborated on different research projects, specifically focusing in rural farm working communities. And so our work really speaks to the way we do community engaged research, but also how do we work with communities to impact and address the difficulties that are happening. And so we start the book by defining what it really means to be community engaged research. And as some of you may know, when you look at research methodologies, specifically community-based and community-engaged research methodologies, you'll see theories, you'll see frameworks, and most of the time these seem very linear in the sense that you have these community-based principles or frameworks that are supposed to guide your research, right? And when we look at the literature, everything is it seems like, oh, we could really change the world with this, right? But oftentimes as scholars, we need to realize that we also have the added pressure of producing, publishing scholarship that's going to get us to the next level. So scholars often get stuck in that a hard or difficult arena of like, how much can I invest in the community and how much can I actually invest in my research to continue to produce. So part of our, the first part of the book, we start with this concept of del dicho al hecho, hay mucho trecho, or in English, from the word to the fact, there is a big gap, right? So we have all these theories, but how are these enacted in practice and how feasible they are in terms of really creating change? And so I have a couple of pictures here from my initial work as a graduate student in one of the rural communities north of the UC Davis campus that I came to as a graduate student at the request of an attorney who was working with the community because they were closing the school, right? And so when I came to the community, along with a couple of other graduate students, we did not come to the community as researchers. We came as community members who were from a community next door, UC Davis, and wanted to help families who were experiencing these difficulties with the educational system in their communities. So our approach to really engaging with communities stems from that approach, that we oftentimes don't come to communities as researchers or with the prescribed research project, but rather coming in with an open heart to engage with communities, to think about how do we help the communities in terms of what they're facing in that moment and what they want us to help them with, rather than coming in with the prescribed research project. So the other concept that we describe, or the next chapter in the book, talks about Haciendo Tamales, or making tamales. And this is our community engaged work with immigrant women. And we decided to title this chapter Haciendo Tamales because of our labor with immigrant women, that it's a long process. It takes a lot of community to be able to make tamales. As many of you may be thinking about during the holidays or special occasions when you're making tamales with your family. It's a day-long process, and oftentimes everybody's involved. That's how we approach our work with immigrant women, that we work together as a community. We see it as a long-term effort and collaboration. collaboration with the women that we have engaged with over the decades in various communities, not only in the community north of UC Davis, but also in the San Joaquin Valley and throughout the region. And one of the examples that we highlighted in the book is how you start to build community, and what does this community look like, and those relationships that are reciprocal. For example, here we are after we came in after we came to help the community at the request of the California Rural Legal Assistant attorney who was assisting the families with the closure of the school. The family said, our children really need tutoring and mentoring services. So we work with undergraduate students to have a mentorship and tutoring program where the graduate students and undergraduate students would come in to tutor and mentor students in the community twice a week. And so one day I recall when the mother said, can you guys stop the tutoring sessions 15 minutes before you're planning on leaving and come back to the conference room? And so when we came back to the room, we found the table with food. And so what the mothers told us was that they wanted to do something in return, because we were already doing something in return for their community. And so they wanted to, in a way, pay us back or show that we were part of their community. And so this relationship has extended over now 14, 15 years. I have left UC Davis, but we transitioned this partnership as, and it wasn't really a transition. It was more that as we were developing different initiatives with the community, more people came on board. So now one of my colleagues from UC Davis, a faculty member in Chicano Studies, continues to collaborate with the community in Knights Landing and has sustained many projects and has brought in new graduate students and new undergraduate students who continue to work with the community. Next, in our book, we describe visible hands, unheard voices, and this is focusing more on the men in the San Joaquin Valley farm workers. Oftentimes we think about the San Joaquin Valley as the region that produces all of our fruits and vegetables for the nation, but oftentimes we don't know, right, what it takes to do that. And so our work with men in the San Joaquin Valley, the goal of that is really to make the invisible visible and the unheard heard. So we've done various projects because of COVID. We kind of halted those projects, but every month colleagues from UC Davis would come down to do workshops with men around men's mental health, acculturation issues that some of the men may be experiencing with their families or their children. And in order to do this work, it has been interesting. Specifically, for example, here you have my colleague, Dr. Yvette Flores, with the men for one of our projects or one of initiatives. But one of the stories that we always share is how we had to bring in Dr. Hector Rivera Lopez to work with us as well, because as women, Dr. Yvette Flores and myself were actually not participating in some of the initiatives. So we were the ones that were going out, bringing the food. We would stay outside in our cars in the parking lot so that the men could really engage and open up in these difficult conversations that oftentimes they may not open up with anybody else, or that they want to discuss certain topics that they probably wouldn't do it with a female in the room. So thinking about how do we really engage with communities, diverse communities, really is something that our community engaged work capitalizes on the assets of the community, but also bringing in other collaborators who can help us continue to collaborate with communities. Here we have Dr. Hector Rivera Lopez, and he calls his work Compadres Sin Fronteras. So his background, he's Puerto Riqueño, and the community that he's working with is primarily Mexican origin farm working population. So he always resonates how it takes to, he always discusses how he's able to engage with men from various backgrounds, because he opens up as it's un compadrismo. It's not, I'm not here as a psychologist. I'm not here as a researcher. I'm here as your compadre, and let's talk. So when we think about our community engaged work, is do we come in as researchers, or do we come in with an open heart and really think about how we're going to bridge those gaps between cultural differences that may exist with the communities? And so part of the work that we also talk about is Cambiando el Futuro, or changing the future, the importance of working with youth, and how do we engage youth in meaningful practices and initiatives that oftentimes many of the youth in our communities have been marginalized and have experiences that they've been push them out of the system, or that push them out of the educated, or these are some of the reasons why they're falling through the cracks, as we know with the educational pipeline. So how do we find ways that the youth began to trust community engaged researchers or individuals who really want to make that change in the community and work with them and to have their best interests in mind? So we discuss some of those practices, and we bring in some of our background in education and in psychology, but also working in school systems, outside of school systems, and how do we address some of these challenges from various angles. So one of the examples that we described in the book is through our work in the San Joaquin Valley, one of the research studies, Niños Sanos, Familia Sana. And when we came to the community, we said, we are applying for funding, and we want your input in this process through the grant application. We explained that two communities would be part of the research project. One would be the control group, meaning they would not get the intervention activities, and the other one would be the intervention site. They would get all the intervention activities. But again, oftentimes when you are doing research in a matched cohort design, the control group oftentimes does not get anything. You don't want to mess with the control group because you don't want to contaminate the data in terms of your intervention. So that's the traditional methodology. As community engaged researchers, we wanted to do something different. We wanted to work with communities to provide activities that had nothing to do with the intervention activities. So we conducted a series of focus groups with the community and asked them, knowing what you know of the study design, what are some of the things we could do to work with the community, to help the community, or that the community may need, really? And so they said, we really need a lot of our projects here for our youth, for our family. It's a very small rural community. There's no movie theaters around. So extracurricular activities are very limited as well. And so after a year of working with the community and the youth and family members, the community came with the concept of this mural. And so the narrative of the mural, this mural was conceptualized by the community members. It was led by undergraduate students who were part of the mural workshop class at UC Davis. And they guided high school students through the process of developing a mural, from developing the narrative to the actual painting process of the mural. So as you see here at the far end, where you see the farm worker, this mural really tells the story of the community, that many of the community members came to the US because of their relatives who were part of the Bracero program. So they came to the US to work the fields in the San Joaquin Valley, or in California, or oftentimes also in Arizona and other states. And so as you progress, many of those individuals settled roots in the US and started to have family members. And so here towards the center, you see a grandfather sharing stories with his grandchildren about some of the traditional practices. So back here you see some altar and the traditional folklore dancing of the viejitos. And so those are some of the traditions that the youth felt some of their family members were trying to pass down to them. And then at the very center, you see a family. You see parents reading to their children. And what this represents is the importance of education for the community. Many of the youth would share that their family came and immigrated to the US for a better future. And what that meant was education. They would acquire a better future through their education in the US. You also see, as you move towards the right, you see another folklore dancer. You see individuals having fun, and that represents the community. How oftentimes the community has festivals within the community or an open market where people get together. You also see in the background some of the Punjabi community hall and the Sikh temple. And so there's also that representation of diverse community members within the community. Finally, to the far end, you see 4 individuals who have now graduated or have gone on to different professions. But as you get to the corner, you also see a gate, and it's not very visible in this image, but what you see here is the gate, and you see an individual reaching down to the dark of what is the shadows here, trying to pull 2 individuals up. So when we were working on the mural, I asked one of the high school students, what is this? What does this represent? And what she said, well, it really means like oftentimes a lot of us get stuck in the shadows. We fall through the cracks, but then there's people within our community that pull us up. And so like you and some of the undergraduate students who have come back and try to really mentor us and tell us what's the importance to get us to be these 4 individuals that have now gone on, but continue to have roots within their community and bringing that change back to our community. So our overall goals with our community engaged methodology is to think about community empowerment. How do we use these research tools, these research methodologies for community empowerment, not only within the educational field, but the health field as well, and in general, that we really see a community engaged research methodology that is the practice of Cultura y Corazon, that when we come into the communities with an open heart and really think about culturally competent practices of engaging with the community, we could enact this community empowerment. And I say enact because oftentimes when we say we foster, we create this community empowerment, we oftentimes come in with the assumption that communities are not in power. Communities are in power. It's about helping them enact, because there are systematic challenges that do not allow that empowerment to shine through or be activated. And so we really hope that our work helps with the fostering of community health and overall well-being. As you may know, we, the Chicano Latina community has some of the greatest disparities across the board: education, health, specifically in the San Joaquin Valley, within Fresno County, Tulare, Kings County. Fresno and Kings County are ranked at the lowest rankings at the national level in terms of their health and education indexes. We also see our work as a way to support community cultural wealth. Like I mentioned, we acknowledge that communities have assets and knowledge that needs to be elevated, and that our scholarship can be a way to enact that community cultural wealth in bigger platforms, not only within the community, but hopefully enlighten other research and how to engage community members and engage their community cultural wealth, their assets, and their knowledge in the research process. And so that led to our collaboration of Cultura y Corazon and where we compiled our experiences of community engaged research scholars. Over more than a decade of our work has been documented in this book with key examples and case studies of how we could continue to engage with families and diverse communities to do this type of work. And so now that I've been at UC Merced, I've taken my work to the next level where I have developed research collaborations with communities, specifically with promotoras. So this is a group of promotoras in the San Joaquin Valley, and the promotoras are now research affiliates of UC Merced. So for the last 2 years, I worked with UC Merced administration to facilitate this process where promotoras were able to take the IRB certification that it's needed for them to assist not only with the study design, piloting of instruments, but also to help with data collection and data entry and data dissemination. So we've trained more than 20 promotoras as research collaborators now, and they all get paid through UC Merced. But as research affiliates, we really see them as research collaborators. Oftentimes when we looked at the literature on community engaged research and specifically the work, the field of promotoras, promotoras are really described as the bridge between communities and researchers, but they're oftentimes seen as as consultants, where they are only consulted on a need basis in terms of what it's needed for the research process. What we've done over the last year with the promotoras is that the promotoras have been involved from research design all the way to dissemination. And so as research affiliates of the university, they have a UCMerced.edu email address, have access to university facilities, including conference rooms. If they want to host a meeting or a convening on campus, they have access to the library and other facilities that undergraduate students or staff can access with the UC Merced ID card. So with that said, I'm going to open it up for questions.
Yeah, thank you so much, Dr. Manzo. So we'll now be answering the questions that y'all have been submitting through the chat and Q&A. So please continue to submit them through the Q&A if you have any additional questions. But I will first begin with a pre-submitted question. And the question is, how do you engage with both institutions and activist communities, especially if they are engaged in conflict or opposition?
That's a very interesting question, because it's something similar to the work that I've done with promotoras, right? As I mentioned, like oftentimes it's only like, oh, let's work with these communities or this organization as we need them. A lot of my work is around promotora groups in the region, and they are activists because they're advocating, they're going out. You know, the term promotora literally translates to promoter, somebody that's out there promoting activities, somebody that's out there advocating for opportunities to address some of the challenges in the communities. So in my experience, I could tap into a specific example working with the promotora group who in the San Joaquin Valley was experiencing some issues with the school board, and they were advocating to change some of those issues and challenges, and the system was not listening to them. And what ended up happening was the promotoras led a school board recall and ended up recalling half of the school board in that institution. It was very challenging because as a researcher at the institution, I had to walk a fine line, you know, and how do you, and so as Dr. Flores is nodding, we have to walk a fine line, right? But also acknowledge that you hold certain social capital and resources that some of our communities may not have access to. So for example, I stood in the background, but I made sure that I worked with the promotoras who were doing the activist work and informed them of their rights and what they could do, right? So for example, a couple of the mothers wanted to speak at one of the school board meetings. And when they went up to the mic, the school board president said, "You have 30 seconds." While these mothers were prepared, citing the California Educational Code. And they started off by stating the Educational Code. As soon as that happened, I'm sitting in the back in the audience. I see the school, the district attorney, the school district's attorney go up to the school board president and whisper something in his ear. These mothers spoke for 10 minutes. And so as a scholar, I probably, I did not go up to the mic and speak with the mothers, but I was working in the background, you know, because my PhD is in education. So I knew about the rights. I knew they could cite the education code. I knew what was not being done. And so being able to find ways to empower communities in that sense can really go a long way in creating change, because we are in positions of power. And how do we use our positions, our knowledge, our social capital to extend that to our communities?
That's so amazing and inspiring, like people have mentioned in the chat. So thank you so much for sharing that. And we do have a question in the chat, and this individual stated that they wanted to learn more about maybe a dilemma or a hard time that you've had in this work. So can you tell us a bit about the specifics of a challenge and how you overcame it and work things out with a community member or multiple members, or maybe some things that sometimes can't be resolved and that are just tensions that are part of this work between university-based and community-based folk?
Ooh, there's many examples, just like the one that I shared now. But I think part of the difficulty, I think as a scholar, we have the pressure to publish and to produce, right? And so oftentimes we get asked, like, what's your research project? Why are you doing this work in the community? And I always tell my colleagues that I don't go into the communities with a prescribed research project. The communities are going to be the ones that tell me what my next research project is. Because with this type of work, you really have to evolve and adapt as a scholar. And so that's the difficult part. I think one of the challenging parts also as a scholar is that we're picking up different expertise or different areas because of the needs in the community, right? So for example, one day there may be an environmental health issue. So I have to delve into the environmental health literature and tap into my network of colleagues to collaborate with them to address the needs of the community. There's always going to be issues between relationships, forming relationships with community members, whether it be bringing in other collaborators from the university. And I think that's a big challenge, right? Because I oftentimes feel as I'm acting as a gatekeeper, right? Because whenever I hear a colleague saying, "Oh, I want to work with the promotoras, can you connect them with me?" And I'm like, let's talk first. Let's talk, you know, and then working with one of the promotora coordinators and saying, okay, we got to set some ground rules if you're going to work with this person. And oftentimes sounds selfish, but we really got to make sure that we are allowing these collaborations to develop with other collaborators because the community needs it, but that they're doing it for the right reasons and that our community is not going to be taken advantage of.
Thank you so much for sharing that. And I will go ahead and move on to a question in the Q&A, which states, what are some of the hardships San Joaquin is facing during COVID, and how can community-based research help with resilience efforts now and in the near future?
Right. So right now with COVID, it's been very challenging because all of our, as researchers through the university, we're not allowed to do any in-person, even if it's within the public health guidelines of staying 6 feet away or masking up. We were just told we cannot do any in person. And so that has been challenging for a lot of our communities. One of the things that we have been able to continue some community engaged work, but that's with those communities that we had already developed a strong relationship with. We haven't been able to collaborate with new partners because of COVID. The other challenge specifically in this region is the access to internet and technology. And so many of our community members may not have access to internet, may not have devices to connect to the internet, or know how to navigate the Zoom world. And so those are some of the unique challenges that we've experienced during the last few months with COVID. We've seen a lot of frustration with parents in terms of not being able to help their children in the school system or navigating telehealth world. You know, those are very real challenges that have been very limited. The work that I've done with promotoras, some of the promotoras have been helping other community members and helping navigate some of those challenges. But again, it's not enough because this is not just about having access to internet, but it goes beyond that, that oftentimes family members live in multi-generational households and children may not have the space to do their classes, or a family member may not have the resources or the space to do a telehealth visit. But as we are transitioning or thinking of how has COVID really helped us, this really puts in a different perspective for community engaged work and how we think about engaging with communities and what are the type of challenges that need to be addressed within that context.
Thank you. And we do have a question from Dr. Flores. Did you meet any resistance from the university in regards to getting promotoras access to campus spaces and emails, and how is that process?
Yeah, so we tried to do this through UC Davis because I started doing a lot of work with promotoras at UC Davis, and the city certification, which is the certification for promotoras to be able to handle research data and do consenting of participants, was only available in English. They would not buy the Spanish license. So we tried, and it never happened at UC Davis during my time that I was there. At UC Merced, that process was a little easier. I just went to the VC, the Vice Chancellor of Research, and said, oh, this is an opportunity. It could really benefit the work that we do here in the region, and it's aligned with the mission of the university. And so from what I hear, that was not too expensive to get the license in Spanish, so they did it. There was a little bit of resistance. We had to justify why they needed to have a UC Merced email address and access to resources, you know, so it took a lot of justification, going back and forth, talking to people. But at the end of the day, we won that battle because they're not just consultants. They're the ones that are helping us design these research studies. And the promotora group that I've been working with have now been have successfully completed 2 research studies. And I'll just share one example, is that we had a group of undergraduate students as research assistants, and we had the promotora group. And both groups had the same test, 200 surveys. This is your target population. And so the promotoras collected 200 surveys in a matter of 4 hours total. Versus the students, we had a larger group of students working on this, took them 16 hours. And so when we showed these numbers to the administration, they were on board for everything. What else do you need for the promotoras? So I'm now writing as research proposals are being written through the Health Sciences Research Institute at UC Merced. Just 2 weeks ago, I got called for 2 different research projects and said, this call really has a community engaged section that we need. Can you do this with the promotoras? And I said, yes, if you give me the budget, we can do it. And so when I write in the budget, it's a very generous budget. You know, we're paying the promotoras $25 an hour. And we are also asking for additional funding for participants and resources for the promotoras.
That's really amazing. And we do have another question. So when you use the word resistance within the institution, is it specific administration and personnel names or actual codes and restrictions written somewhere?
It's both, you know, oftentimes these administrators want to follow everything by the book, you know, and are saying, no, this person does not work for UC Merced. Well, they do. We're using our grants to pay them, you know, and so we're paying the organization who then pays the promotores, but they are part of the institution. So it's both. There's policies and procedures that need to, administrators need to uphold. So for example, nobody can have access to research data unless they've gone through this certification, right? And to be part of that certification, you have to be part of that institution. So our argument was, well, we know the promotoras can successfully collect this data. It's going to be more cost effective, but in order for them to do this, we need to give them access to this. So you need to make them a UC Merced affiliate to have access to this. And so it took a lot of justification in terms of that and working with individuals to overcome those challenges.
Awesome. So currently I don't see any additional questions, but I do have one for you. So I was just curious if your research within the San Joaquin Valley can be generalized to other locations or areas in the US.
Yes, definitely. So there's definitely going to be a lot. My work is primarily with the Mexican origin farm working populations here in the San Joaquin Valley. But as I mentioned, I started my research up in North Sacramento region. One of my colleagues was working in a suburban area in the Sonoma area. My colleagues, Dr. Eva Flores, Dr. Hector Rivera Lopez, have done a lot of work in the Bay Area, and we describe a little bit of that in our book and how some of this is across the board, but we also acknowledge there are differences. So for example, geographical differences. One rural community may be very different from another rural community, but really thinking about our research as a practice with Cultura y Corazon, that's our goal, to help provide that framework and that guidance for researchers to think about those nuances and those unique differences that exist within our diverse populations and how to engage with communities.
I see, thank you. And yeah, we don't have any additional questions, so I think we can start closing off. So I'll hand it to Dr. Flores to end our session.
Yeah, so I think I just want to open it up and see if there are any last questions that folks want to write in the chat. And as I give some closing remarks, but I just want to thank Dr. Rosa Manso for showing us the possibilities on how we can, engage with the community more and how to bridge the institution with a lot of, our objectives and goals that we want to do, and doing it in a way where, like you were saying, our heart is open. And also doing it in a way where you acknowledge power differentials and acknowledge that the community itself does have power, and there are ways of, finding ways of leveraging it or like you were, strategies of kind of going around that. But yes, thank you so much to SARC also for helping us put together this event. If you're doing this for Chicano Latino Studies certificate, just make sure that you fill out the colloquium summary form and that you submit it to me. If you have any questions about the major, feel free to reach out to me. And if you have any questions about Dr. Manso's book, then feel free to send her an email or ask her right now. Yeah, I think I'm just gonna check the chat. There's one more question that popped up, Alina, if you want to.
Yeah, I can take that. Thank you. So the question is, doing the research design with the promotoras, did you do a training institute of some kind with them about methods and research design?
Yes, we're actually writing a paper about that process of training the promotoras as research collaborators, and describe some of the training that we did around survey development, research design, data collection. And so we actually, when I described the research design process, part of that involves the piloting and the co-developing research questions with the promotoras. And that's a way to ensure that cultural relevance. When you look at the literature of doing community engaged research, you're going to see all these key terms like you got to make sure it's culturally competent, culturally relevant for the population, for your target population. We describe in our methodologies, this survey has been validated, right? But what does that mean if you're just running statistics to have a certain power within your measurement tools? But what we do is that we co-write, co-pilot our measures with the promotoras.
Thank you for answering that. And I will ask if anyone else here has any last minute words to share before we close off.
I actually do have another question. I guess I was just wondering in terms of, like committee members and putting this research together and involving doing like this methodology. What were some of the comments that you received about doing this methodology? Was it always accepted or not?
Yeah, I think when I initially started this type of work as a graduate student, people didn't really see it as a method. It was more like, just let her do the work. She's a graduate student and she's doing this for the control community that has nothing to do with our research study or our intervention, right? But as we started to actually, like I mentioned, I don't see my work coming into the communities as a research project. I see it the other way around. I come into the communities and the community work turns into my research. And so being able to publish, obtain grants out of that approach has really made a difference in the academic world. As you could imagine, now people start to think about like, oh, you're getting funded. Oh, you got this grant. Oh, you got published. Then they start to pay attention.
Thank you so much, Dr. Manso, for enlightening us and just showing us, what's possible in our work and how we can do this.
Thank you. Thank you for having me.
Awesome. I think we'll go ahead and close out, but just wanted to share that this recording will be available through the SARC YouTube channel in 1 to 2 business days. And I believe also, Dr. Flores, it'll be available on the Chicano Latino website as well. But yes, if you do have any questions, feel free to reach out to us at sarc@uci.edu. And then I think Dr. Manso, if you're okay sharing your email address, we can also share that too, or your publication as well. But thank you all so much, and we'll go ahead and close out. Take care.
Thank you. Bye-bye.
Bye.